You may not think of the immigration crackdown story as a healthcare story, but it is. It's because the Trump administration has ramped up rhetoric, spreading lies, and blaming immigrants for the skyrocketing costs of healthcare. America is a nation of immigrants. My own family is an example of that. And it's highly likely that your own family may be an example of that as well. When my parents came to America, they coupled unyielding hard work, dedication, frugality, with a deep commitment and humility to their professions. Yet they, like so many, needed an opportunity to build a life in America to realize their potential. This is why the Trump administration's attacks on immigrants hit so many of us so deeply and so personally. These impacts are broadly felt on all of us, whether you know it or not. In November, the Trump administration proposed denying residency to, again, legal immigrants who used Medicaid or other housing or food assistance programs. Even without passing a new law or changing a regulation, the rhetoric itself is causing waves of fear across Black and brown immigrant communities. This is leading immigrants all across the country to avoid necessary healthcare, even emergency healthcare. And according to a new survey from the Casa Family Foundation and the New York Times, 1/3 of legally present immigrants across the country say they are afraid to go to work, to travel, or to even spend time in public places. Lisa Cuestas, president and CEO of Casa Familiar in San Diego, has seen this firsthand.
The range of needing to support people because it's chaos and because of the color of their skin or because of how much they look like an immigrant or a Latino, they want to avoid having that kind of interaction. When you are seeing ICE getting into what should be safe spaces, some of the hardest and scariest things is that when they come to us, they may be needing assistance with the form, but then we realize they don't have a lot of food, they haven't been leaving home much. And that is where we connect with folks to really make sure that something that they thought was just a minor pain doesn't turn into appendicitis.
For Youman Wilder, a baseball coach from Harlem who defended his players from ICE this summer, the presence of immigration officers in uptown Manhattan has had a chilling effect on families and his players in the area.
We had just finished up practicing, and I just went to some basketball. The basketball's right next to the batting cages, and I just saw them come by, and I walked over, and they're like, "Where you from? And are you here legally?" And it sounded friendly from the beginning, but it went from 10 to 900 real quick. I just had to tell them that I'm in charge of these kids, and they'll just have to invoke their Fifth Amendment right and ask. You can't ask them any questions, and they have a Fourth Amendment right for you not to search or anything of them. So that's how I had to go about it. But we were targeted because up where we were, which is on 72nd Street, it's pretty white, upper class, and we were just a bunch of kids who I didn't look at the race at the beginning, but now I've had some distance, and you can see that we were definitely looked at as, okay, this could be something.
And so they left once you invoked, on sort of the collective behalf, their constitutional rights.
They left, but the thing of the matter is, it's a batting cage, and you can get in this batting cage one way, and you can get out only one way. So I was in the back. I told my kids go to the back of the batting cage, and there's a fence there. And I said, if you have to jump that fence and get over it and get out of here, that's what you're going to do. One of them just called me a YouTube lawyer, and they just dispersed. And my thing is, how did they get here? I mean, how did they get here? And then, we go 3 or 4, weeks past them, and you realize they're coming in unmarked trucks and things that look like delivery trucks, look like parcel trucks. So I was wondering how they got here and how they disappeared. I just didn't, it was like puff, because I told my kids to get out of here. I walked them up the stairs. I came back down to get my things, and everyone, they were just gone.
There was a lot of fear then.
Once they got home, once they saw the news about it, I think it became, holy crap. I got so many calls from so many parents who I love you, Youman, but I can't have my kid come down there, and that's the way it's been since then. I think what's happened now is I can't send my kid here. I can't send my kid here. And now, and with ICE, I've kind of limited everything right here. I can't grow. There's no growth in it for those immigrant people because they're hiding, they're running, they're not free.
Dr. Andrew Goldstein, a primary care doctor at Bellevue Hospital in New York City, says his patients are afraid to sign up for SNAP benefits or Medicaid because they're worried about being put on ICE's radar, especially since the Trump administration has allowed health data to be shared with immigration enforcement and Homeland Security.
Is that I have a lot of patients who come in and express their fear, their anxiety, their stress level about what's happening. And they tell me it affects them when they're taking their kid to school. They tell me it affects them when they're doing other things in their community, including when they're pursuing healthcare.
And this would be access to just your basic screenings for chronic disease, for cancer, if they have concerns for the flu, sort of the gamut of potential medical conditions or reasons why they'd visit you.
It's very parallel to when health insurance costs out of pocket feel way too much. People avoid preventive care, people avoid screenings because it doesn't feel as urgent as the financial things that they're facing day to day. Same thing here. I think people are making a choice about what feels most urgent. If they're scared that ICE is going to, in some way, come after them, persecute them or their family, they don't want that. And the flu vaccine or diabetes care might feel, less relevant to them in that moment. And I don't judge them for that. I think it's constructed reality for them that is really unjust. And I think ultimately, they're just trying to protect themselves and their families, and that makes a lot of sense. The toll that I'm seeing on my patients who come in with severe anxiety, insomnia, depression because of what they're hearing about in the news happening in New York City or just nationwide, it's really unacceptable. These are just human beings, and they need to be treated with the same dignity and respect as all of us. They do not deserve to be persecuted, and the harm that they bear on this is totally unnecessary, and we should stand against it.